Hello and good evening, ladies and gentlemen. My name is Michelle Shabo, and thank you for joining us for another episode of Health Matters, a program brought to you by Worcester District Medical Society and WCCA TV. I am a new host, and I'm a fourth-year medical student at University of Massachusetts Medical School. This evening, I'm joined by Ezequiel De Leon and Katherine Sadaniantz. Would you guys just mind introducing yourself and telling me a little bit about your roles at UMass?
Awesome. Thanks, Michelle. Hello, everyone. My name is Ezequiel De Leon. I'm a nursing student at the UMass Graduate School of Nursing. So I'm currently a first-year nurse practitioner student moving on to the second year. And I also work as a nurse on South 5 at UMass Memorial. So,
Thank you for joining us.
thanks.
Yeah.
Thanks, Michelle. I'm Katherine. I'm a fourth-year medical student, as you know, in the same class, and I'm going to be applying into internal med this coming year.
Yeah, so I'm super excited that you guys are here with me this evening. I thought that we could talk a little bit about, last time I was on the show, I talked a little bit about a quality improvement project that I did at school focusing on telehealth options for patients, especially important during this time of COVID. And I thought that your project would be really interesting to our viewers because it's something that really affects the patient experience when they're in the hospital. So do you want to talk a little bit more about your project?
Yeah, definitely. I think it's very interesting that you had the insight to notice that, right? About how much this affects patient experience and satisfaction. Mm-hmm. Because as a nurse, I know that sometimes the things that I know are very important for the patient, like their metoprolol, is sometimes not as important to the patient as getting up and going to the bathroom mm-hmm. or being able to have a good night's sleep.
Absolutely.
And so, like you, me and Katherine started doing the sleep quality improvement project through an educational opportunity that the UMass medical system had put together. And so we joined the Interprofessional Training Quality Improvement Council, mm-hmm. Where we were kind of shepherded into using the lean methodology and Six Sigma methodology for quality improvement. And our group leader, Nick Hebda, came across this problem or point of improvement on South 5 where patients were experiencing unrestful sleep and above average noise. Mm-hmm. And this was actually reflected in the HCAP scores for the floor. And so from that came this idea of what can we do through this opportunity that we were given to improve this process. And so we worked on identifying the problems on the floor as to why patients were experiencing this noise and this problems with sleeping, mm-hmm. and putting together some meaningful interventions. So it's pretty exciting.
I think as medical professionals, we always say it's so important, please get good sleep,
Mm-hmm. Right.
and we leave them on the floors, and it's true, sometimes their sleep isn't that great because they have to, come in and get blood draws in the middle of the evening, or their IVs are loud, and I'm sure that you found lots of things that contributed to poor sleeping on the floor. So what were some of the things that you noticed were contributing to poor sleep?
So we actually, I think Zeke, you did this as well. A couple of us on the project did some overnight shifts.
You really got in there to find out what was the problem.
And we would take a measurement of the decibel level, the noise level on the floor every 15 minutes and record that, and also record any noise event that happened. And at least the night that I was on, I was looking at 3 different rooms mm-hmm. and seeing how many times they were interrupted as well, because we just wanted to get a full picture of everything. Some were normal things like nurses having conversations, providers having conversations.
In the hallways.
Mm-hmm. Checking in on patients. If you're in a double room and one patient wakes up and needs medications, then of course that disturbs the other patient. There's always the beeping alarms, huge one. And then one that I always find kind of funny is that at some point at 1 a.m., down the hall, a maintenance man was breaking down glass.
Wow.
Not sure why that happened, but Lots of different things
But
contributing to that
something
sleep.
that you wouldn't have found out had you not gone in there yourselves and tried to figure out exactly what was contributing to sleep? Because, as providers, we really only see patients when we go in the morning and round and they say, no, I didn't sleep very well last night. But you guys use a true scientific method and really got in there to see what was the problem. That's really incredible. And what were some of the key lessons that you took away from the project?
Yeah. So from the project, we took those things that we identified, right? The interruptions, the loud conversations, and we turned those into action items to act on.
Yeah.
And what we ended up doing was we did a quiet hours protocol. So we set up some quiet hours with the aid of the nurses on the floor and the staff, and really educated the staff on things we could do. Because what we found was that there were a lot of problems. There were also a lot of resources available, but they just hadn't been tied together and facilitated for use.
Okay.
And so when we actually established quiet hours and put up the posters, then that became something where everyone can hold each other accountable. And when we organized the headphones and sleep mask and eye kits, then that became something more tangible for staff to be able to give to patients. And we gave the responsibility to the unit secretary of making an announcement saying quiet hours are now beginning. Please let us know if there's something we can do to help you sleep. And so these things really allowed us to move sleep forward on the unit. And the biggest lesson that we took from that was how important the people who were doing the work, involved in the work, were to getting the actual project moving forward. Because originally when we were discussing, okay, well, how do we make accountability in this?
Yeah.
And the unit secretary was a huge part of that.
Because you can just tell people what to do.
Right.
But you have to make people feel invested in the process.
Yes,
Yeah.
exactly. And so originally we were talking about maybe we'll have the charge nurse do this. And then it became a question of that's just an added responsibility, and will it get done, and what is their buy-in and things of that nature. But having the unit secretary do it gave the responsibility off the charge nurse, who already has many other responsibilities.
Yeah, lots of things.
And also empowered that person to be the primary person, so reminding people of all the resources that we had discussed and set together. So,
wow.
But it wouldn't have been possible if we didn't have that conversation with that unit secretary to begin with. And so doing a real survey and knowing who the players are, who the individual people are in the unit, who is excited, who is hesitant about change, was really vital to the success of the project.
It's so important that you bring that up about what were people's attitudes about change, because we always learn in medicine that, we can tell a patient to do something, but, some of the techniques that we learn in medical school are about, motivational interviewing and assessing how invested is someone in making change, because, someone needs to want to make change. It sounds like you guys really instituted a culture change on the floor. And reallocated roles, not just to, charge nurses or the nurses who are in charge of their patients, but it also sounds like you gave some ownership of sleep to the patient themselves. Right. Giving them the supplies that they need to, have a healthier sleep that night. It sounds like you really fostered a culture change. How did people take to it?
Well, I think Zeke was also, that's a huge compliment about the culture change, so thank you.
It's hard to make a culture change.
Very nice of you.
Yeah.
I think Zeke, we had a couple of conversations about this. We've talked outside of the project as well about interprofessionalism and the fact that, we have a built-in hierarchy in medicine that goes back ages, and how I think we all now are kind of trying to break that down and really involve each other. So Zeke was pretty instrumental in making sure that our team did not just say, this is how everything should be done, now do it.
Yes,
but
that never is going to work.
Yeah, but rather go in and be like, we see this problem. Do you see this problem too?
Yeah.
And that way you can be a lot more receptive, and it's not just like a doctor versus nurse problem or a medical students and nursing students always having projects ready, putting an extra task on someone. So I think that the way that you were able to approach that and ask for input made it a lot easier, and people were totally receptive, I would say.
It sounds like you were very careful also about like not imparting blame, right? Because it's not one person's fault. It's like this, you know, multi levels of problem, you know, and so getting people's temperature of the situation and making them aware, you know, and having them volunteer that they realize it was a problem, and not just telling them this is a problem, I think is so huge. So it sounds like you guys have a lot of success with your project, and I hope that it's something that can be taken to other floors as well. So congratulations. I think that was a project I was honestly most excited about, other than my own. But yeah, won't be biased. So I thought another thing that would be really interesting to talk about during this time, I know it's huge on everybody's minds, COVID. And as students and as someone who works at the hospital, I just wanted to, you know, get some opinions from you guys on how has this changed your experience as clinicians during this time? I don't know if you guys just wanted to talk about that a little.
You want me to go?
Yes.
I can jump into it. So the way, I mean, you were there, but I'll just explain for everyone. So as students, since we're not employed by anyone, we were off the wards for a while until June 1st. And that's when we were actually allowed to start on June 1st. And I start at Memorial, which Zeke was also there as well. And as I was starting on a medicine sub-internship, so acting as if I were an intern, but without all the pressure. During that time, I had quite a few patients who ended up with really tough diagnoses and things that we didn't expect. And when I say tough, I mean like cancer diagnoses. And we weren't allowing people in the hospital about midway through June, I would say. So I would give a patient this terrible news, and you know, all they can do is like call their family. We offered Zoom, but like that's not always the best replacement. So just because I feel that someone in that situation really needs that support that they're not able to get virtually as much, I would, with like one of my patients, I would go down every day and just like chat with her for an hour before I leave, because they need some kind of support during that time. But for me, that was a really tough part of it, just seeing people without their families during this terrible time.
And knowing that need was there. I can't imagine how difficult it must be, you know, leaving a patient alone in their room with such difficult news. I mean, I know I shared this the last time that I was on the show, but that was one of the most difficult things for me when I was in the hospital with COVID, is not being able to have anybody there with you. I mean, I think as humans, they say it takes a village, and we really thrive off of being able to be with people that care about us. And you know, virtual, I don't think will ever be a replacement for that. You know, it's a great replacement for other things in medicine, but like nothing I think can replace human presence. And I'm sure your patients look back on that time that you spent with them and are very appreciative. And I'm sure that it has an impactful and memorable experience for you as well.
Definitely.
Yeah. And Zeke, so you know, when I was in the hospital, the person I saw the most was my nurse. I loved my nurses in the hospital. So I'm sure that you have a lot of experience of what it's like during this time.
Right.
Yeah.
I do want to say though, like I'm so happy to be here with you guys, because it's so just evident how you have that human side of medicine in you. You know, that you were able to take time to do that with your patient and to reflect on that. Like it's like that's what's gonna make like really good healthcare providers. And I try to do that in my practice as a nurse now.
Yeah.
You know, when you have like the list of 20 things to do, but you make sure that the patient doesn't know that you're there in full presence with them, and make those like 2 minutes feel like 15, right?
Mm-hmm.
Yeah.
But it's interesting because in nursing, we really always talk about the patient as a human, and nursing is defined as like studying the human response to whatever it be, whether it be medical situations or like social, all those things. And so when COVID came and visitors weren't allowed, support systems weren't allowed in the hospital, it became even more evident about how important that family circle, how when you have that patient, it's not just a patient, it's their father, their children, because those were the people that were calling, right? So then now, as a nurse, we have to try to help. We fielded a lot of phone calls trying to make sure that everybody was involved, and like just listening to the patient's family members often crying on the phone about how hard of a time this was, that they couldn't be there with their family member. And I think it was tough to hear people have those like emotional breakdowns through the phone.
Yeah.
But it's also amazing to be in the field where you can be a support system for people that are going through that. You know?
Yeah, it sounds like you've taken on additional roles during this time, and it's not just caring for your patient. It sounds like you're doing a lot of caring for patients' families and loved ones as well.
Yeah.
And I've seen you on the floor. I've seen you a lot last month. Since I was on a urology rotation, and Zeke's floor cares for a lot of urology and your gynecologic patients. I have seen you apply such humanism to your patients, and always remind us and bring the patient down to our level and make us understand like what this experience is like for that patient. And I always appreciate your perspective on those things. But I think also it can be it can really wear on medical professionals. It's been many months now, four months now, since COVID has really changed our lives, and I think it over time has been exhausting for medical professionals. And I mean, I know I feel that sometimes. Do you guys feel that as well?
Yeah.
I feel like I do. I feel like it was interesting because COVID took pressure off the system in some areas.
Yeah.
Like when the surgical elective procedures were gone, that took some pressure off in like staff, but then at the same time puts financial strain, and then at the same time it kind of, I feel like oftentimes in the healthcare system, more needs to be done to get more income revenue, and oftentimes that is done by putting more on the provider, right? So do more with less, right? Get the volume in to kind of to make it profitable or sustainable. Not even, doesn't have to be profitable, but sustainable in the current system. And I was having a conversation with an outpatient provider, and she was telling me how one of the like silver linings of COVID is that it exposed, like it really stressed the faults that were there to the point that we can't go back anymore. Thinking about being a primary care provider and not only having to see patients, but now answering emails and doing telehealth, and how if the only way to possibly look at all those labs is to be up at 10:30, and how that's not sustainable. So it really
has changed the landscape of medicine. Forever.
Right.
I think some aspects of that have changed in medicine as a result of COVID that I don't think will ever go back. Yeah.
But I think the response was really beautiful too,
yes,
right?
I agree.
With all the support that everybody was able to do for each other, especially the medical students, right? With at UMass, they created a coalition where the medical students organized like a center for where people could go to volunteer and delegate different activities that were safe and actually helpful for the institution.
Oh, wow.
So it was great to see that grassroots effort come up. Yeah.
As an SBC rep, were you involved with that at all? The volunteer? This is the first time hearing of it. Oh, sorry.
But
it sounds incredible.
I wasn't on the organizing board.
But do you know a little bit about it?
But I did a couple of the activities there.
Oh, great. What activities did you partake in?
My goodness, you're stressing me now. No, I remember one of the opportunities was to actually work at the DCU Center, but on the homeless shelter side, that Dr. Eric Garcia and Adam Bliss, who's an NP, established. So they just basically asked like anyone who was in medical training, and then of course licensed doctors and NPs to come in, and there were 3 shifts every day, about 8 hours. Yep, that adds up. And we would just make sure that food was being given, medications were being given, vitals were being done, and talking with patients when they had some issues or something like that. So that was really an amazing effort that was organized. I did a couple of night shifts at the DCU Center.
Wow, really important work.
And a couple of day shifts. And honestly, I felt like I was getting more out of it than the people we were serving, because I just saw, how strong they were to not only have this devastating disease, but also be coping with their socioeconomic status at the same time, and still be, some of the kindest people ever.
Yeah.
I remember one woman, she was sick, she had COVID, and she vomited at one point, and she immediately grabbed a mop to go clean it up, and I was like, no, honey, go rest, get something to drink, that's our job. So you just saw this like amazing kindness demonstrated by people in our community that I didn't know existed, honestly.
Yeah. What an incredible experience to be a part of. I didn't work on the homeless shelter side, but I was on the DC Center Field Hospital side for an emergency medicine rotation. And yeah, that sounds like such an incredibly rewarding experience. So before we, wrap up the show for the evening, I thought maybe we could let our guests know just a little bit more about you two and what your professional goals are.
Awesome.
Yeah.
Kathy, you want to go first? I keep putting you on the spot.
Take it away.
Well, I really currently am a nurse practitioner student at UMass, and I'm in the adult gerontology primary care track. So I'm really excited because the aging population is a vulnerable population. And then to think of that vulnerability together with the interacting socioeconomic disadvantages at present, right? Whether it be of color, ethnicity, sexual orientation. So I feel very excited to be studying to practice on these people, and then see how, when I'm out in the field, how I can help bring kind of those interacting systems together. And so I really hope to go out there and take care of immigrant populations, of aging immigrant populations, and maybe one day do some work in policy, maybe some administration, and see how we can get universal health care.
That sounds like an incredible goal.
Right,
I have no doubt that you will make huge impacts.
Right, yes, it's coming.
Yes, I look forward to watching you enact change. And Katherine?
I feel like Zeke just announced his presidential run
Yes.
with that sharp suit. So I'm going into internal medicine, applying this October. Hopefully going to stay at UMass, but if anyone from UMass is watching, please pick me. But what I hope to do in the future is I like internal medicine because it kind of encompasses everything. So it has all the diseases that I could possibly imagine, as well as dealing with socioeconomic problems, things that aren't just like textbook medicine. I really hope to do some work with LGBTQ youth, and also with incarcerated populations. and also with veterans as well. I have a project on veterans. So those are like the populations I'm really interested in working with. Outside of that,
that sounds incredible.
I don't
know.
know.
I'm so happy, and thank you so much for being on the show this evening.
Thank you.
Michelle.
I hope to see what you all accomplish later on in life. And thank you, ladies and gentlemen, for joining us. It's another episode of Health Matters brought to you by Worcester District Medical Society and WCCA TV. Michelle Shabo. Thank you. Yeah, so we'll just talk and...
Okay.